We'll quickly look at short stature in patients. The short stature in patient is basically we are trying to look at the patient is short. So we are trying to look at what are the several reasons why a patient could be short and the rest of it. So short stature in patient is defined as a height that is below the third percentile for your age, okay, and sex on a standard growing chart, okay. So or more 2 standard deviations below the mean height for age and sex. So causes, some people is normal, they just have a short stature, sometimes it's familial short stature, so you guys in your family, you just have short stature, or constitutional delay of growth or puberty. Do you understand? Some people, they grow slower than their age mates. Do you understand? So pathological causes could be endocrine disorders, like your growth hormones are not adequate, your thyroid hormones are not adequate, Cushing syndrome, all those issues. You understand? Sometimes you have an underlying disease condition that is disturbing you so much, so your body is not actually finding time for itself. Do you understand? Then genetic conditions like Turner syndrome, Down syndrome, achondroplasia, skeletal dysplasias, a lot of things like that. Okay. Alright, so evaluation, they can use growth charts to be able to pick up your height. They can use mid-parental height calculation. That one, they also take the height of your parents to now access if it is actually a family issue. And bone assessment studies, where they now do x-rays in your bones to be able to look at all those ossification centers to see if you are actually following your age and all of that. The lab tests, which mostly they get to measure all those hormones you got. Then also imaging like MRIs, where they image the parts of the bodies that or organs in the bodies that are actually having to do with growth. Okay, so the treatment varies. So again, it actually depends on, how do I put this? It depends on what is causing. So from physical examination, medical history, your lab test, you are able to pinpoint what is causing the short stature in a patient. That's where you can be able to now initiate your treatment.